Hi, my name is Christine and I'm a pelvic health physio. The pelvic floor is a group of muscles and connective tissue located at the bottom of the pelvis. So regardless of age or sex, we all have a pelvic floor, as well as the possibility to experience some dysfunction in this area. Let's look at our pelvic model. So we have our pelvic bones and we have our spine. And at the base of this structure is almost like a hammock or a basket of muscles, which are our pelvic floor muscles. If we look from the bottom, there's a diamond shape. So starting at our pubic bone, traveling to our sit bones, and down to our tailbone. And the pelvic floor muscles play some really important roles in the body. So they support our internal organs. So our bladder, the rectum, the prostate, and the uterus. The pelvic floor muscles are also sphincteric, meaning they are crucial for bladder as well as bowel control. The pelvic floor muscles are also really important for sexual function, and they are part of our deep core system, meaning they contribute to support and stability for the rest of the body. So dysfunction of the pelvic floor muscles can contribute to a variety of issues, things like incontinence, overactive or painful bladder, pelvic organ prolapse, low back pain or pelvic pain, sexual dysfunction or pain with intercourse, as well as pregnancy-related pelvic girdle pain. As pelvic health physiotherapists, we have specialized training in the assessment as well as the treatment of the pelvic floor and how it relates to the rest of the body as well as your lifestyle. An assessment with a pelvic physio normally starts off with a detailed subjective history followed by a thorough physical exam. This often starts with an external examination, so looking at things like breathing, posture, movement patterns, strength and flexibility of tissues. Often an internal assessment is recommended because this allows us to really assess the pelvic floor tissues, how well the muscles contract, and just as importantly, how well they relax. Following this, we work with you to come up with a program to optimize the function of your pelvic floor, help manage your symptoms, and often eliminate symptoms altogether. Pelvic floor dysfunction, such as pain and incontinence, are more common than we think, but regardless of age, sex, or childbearing status, they are not normal, especially the persistence of these symptoms. So if you're experiencing pelvic floor dysfunction, I urge you to reach out to a pelvic physio. Ask us questions, see how we can help. You just may find it an empowering and reassuring experience.